And now to health, as Africa's emergence from the COVID-19 pandemic catches on with vaccine adoption strategy and uptake across the continent, attention has been diverted to other public health and medical issues affecting the continent and the world at large. Now, one of such is the human papillomavirus or HPV vaccine uptake, which has been addressed at the summit in Kigali, Rwanda. Researchers, pharmacists and public health doctors are gathered to discuss how best to improve the strategies being used in the HPV communication and vaccine confidence, monitoring and evaluation of HPV programs and its supply chain management and possibly local and international partnerships. And now joining me live to discuss this, I have one of the panelists at the summit speaking about a vaccine confidence now, Professor Charles Wiysonge, who is the Senior Director of Cochrane South Africa, HIV and other infectious diseases. Thank you, Professor Charles, for joining me on the news.
Thank you so much for having me.
It's a pleasure. Now, we've seen that attention has been shifted to the human papillomavirus. So my question to you this morning is, did the COVID-19 outbreak and the shift in focus to curb the spread impede the human papillomavirus or the HPV vaccine uptake, particularly in Africa? I mean, we've seen that for so long our focus has been on the COVID-19 outbreak, and now our focus is shifting. So are we saying that the attempt to curb the COVID-19 actually stopped the spread of the awareness about the HPV?
Yeah, there was a lot of focus, of course, when we had the COVID-19 pandemic, which hopefully is now coming to an end, on rightly so, in trying to curb it, a lot of resources put into that. And by so doing, there was an impact, a reduction in uptake of other services, including HPV vaccination. And also, what also impacted on the uptake of HPV vaccination was, the movement restrictions, the lockdown, so people could not access healthcare services. It increased the cost to go to healthcare facilities and to schools where they give these vaccines. So yes, in trying to curb the COVID-19 pandemic, there was an unintentional reduction in the uptake of HPV vaccination.
Okay, and do we say the same about the funding? Do we say that the funding was hindered or hampered by the spread of the COVID-19 vaccine? Or do we say that the funding is still intact and the research was still ongoing before now?
During these last 2 years, everything was impacted. The funding was also impacted. And even researchers, they had to get some of their efforts to trying to find solutions for develop new vaccines and test them for the COVID-19. But now I think everything is back on track. The research on HPV vaccination is going on. The funding that we had for HPV vaccination, I think it is increasing, and I think everything is back on track now for us to increase the uptake of HPV vaccines and ensure that we protect our girls from cervical cancer and other related cancers.
Okay, Professor Charles, I'm just quickly going to read out the statistics for you, and then you will help me ascertain the veracity. Now, according to the United States Center of Disease Control and the Prevention, or the CDC, the HPV vaccine has the potential to prevent more than 90% of attributable cancers. And studies also show that since the HPV vaccination was first recommended in 2006, the infections with the HPV types that cause most of the cancers and the genital warts have dropped 88% among teenage girls and 81% among young adult women. So how come this discussion on the vaccine confidence is coming up in the conference?
Those statistics, thank you very much for reminding us, those statistics are actually right. And they show the great impact of vaccination, substantial benefits. And just before I go to HPV vaccination, we know that vaccination in general saves lives. It is not easy to forget that diseases like polio, smallpox used to cause millions of deaths in many parts of the world that are now free of these diseases thanks to vaccination. Coming back to HPV vaccination, those statistics that you've quoted show that HPV vaccination have substantial benefits in reducing cervical cancer and other HPV-associated cancers. It has substantial benefits in reducing genital warts. Although genital warts do not cause death, they reduce the quality of life for people. So HPV vaccination increases the quality of life it increases the longevity and it increases the lifespan. But why are we discussing vaccine confidence? It is because of conspiracy theories, misinformation, and false beliefs, many people now tend not to trust vaccines. They don't trust the benefits of vaccines because of conspiracy theories. And that's why we've come here to try to understand what people's concerns are so that we can develop appropriate strategies, have education campaigns that make people understand how beneficial these vaccines have been and how beneficial they can be if we continue to take them. Because a good vaccine lying in the shelf, a good vaccine in the fridge is not effective. It is only effective when we take it, and that is when it will have public health impacts. So for some people, because they don't see some of these diseases anymore, they're just complacent. They believe that it is not still necessary to take this vaccine, or they trust this misinformation. And that's why we are discussing these issues, to ensure that we have tailored strategies and ensure that people take up these vaccines so that we can reduce all these cancers. We can reduce these genital warts, increase life expectancy, and increase quality of life.
All right, Senior Director, Cochrane, South Africa, HIV and other infectious diseases, Professor Charles Wiysonge, thank you for giving us an insight into the HPV vaccination discussions.
Thank you so much for having me.
My pleasure.
God bless.